I want to introduce to you Dr. Michele Tagliati. He is from the Department of Neurology at Cedars-Sinai, Los Angeles, and he's the director of the program of movement disorder. He's a specialist and world leader in Parkinson disease, some other movement disorders, and something very new and exciting that he's going to talk to us about that's called deep brain stimulation. Michele, could you please talk to Enlace Judío about the new things you're doing and the new research and all those exciting things you're doing for helping our communities?
Absolutely. Thank you, first of all, for having me here today. I love Mexico City. I love Mexico. Its rich culture and history. It's a true pleasure to be here.
Our pleasure.
So Parkinson's disease is a neurological disease caused by the slow but unstoppable, as we know now, degeneration of small part of the brain, which produce a chemical that is called dopamine. And this progressive, let's call it premature death of the cells cause a number of symptoms, which are sometimes well recognized, like a shaking of your hands, like a slowness of movement, shuffling of gait, or stiffness of your muscles. And Parkinson's disease is a very common disease in aging population, and given the progressing aging of the population in the world is a problem that will be more and more frequent in front of our eyes. We work every day with patients with Parkinson, and on one hand, we try to make their symptoms better. And the good news is that we have a lot of medications that can supplement the dopamine in the brain and make the symptoms better for many years, actually, 5, 10 years, or sometimes even more. But unfortunately, the disease is progressive. And so after a number of years, the medication are not enough anymore. And that's when we have to either apply advanced techniques like deep brain stimulation, or we need to go back to the drawing board and research and try to find new solutions for Parkinson's problems. The other type of activities that we are now pursuing is to try to understand what causes Parkinson's disease, because I forgot to mention that we have no idea of what happens with Parkinson's disease. We do not know the cause. And as you can imagine, it's very difficult to cure a disease of which we don't know the cause. So much of what we're doing is, on one hand, to make our patient better, and on the other hand, try to understand how the disease happens and how we can cure it in the long term.
You were yesterday at the Instituto Nacional de Neurología giving the main talk with this new tool that you have to improve the lives of those patients. Probably we can start with the deep brain stimulation and what you are doing at Cedars-Sinai in Los Angeles to help these patients.
Absolutely. It was an honor for me to be invited by the Instituto Nacional de Neurología y Neurocirugía to give a lecture on deep brain stimulation, the state of the art. Deep brain stimulation is a relatively new technology, although we've been developing now for over 10 years, which provides a relief of the main symptoms of Parkinson when the medications do not work anymore. And it is a surgical procedure, but a very advanced and technological procedure, which consists in implanting permanently teeny wires deep in the brain, connect them through wires under the skin to a pacemaker. In fact, many people call deep brain stimulation the brain pacemaker. And then by delivering small pulses of electricity deep in the brain, we are able to stop the shaking, to improve the movement, and to relieve patients with Parkinson of many of their symptoms. And in fact, deep brain stimulation has been defined as the second revolution of the treatment of Parkinson's disease, after the original discovery that levodopa, the dopamine precursor, could relieve the symptoms. So now we have levodopa and similar medication for the first, let's say, 10 years, 15 years of the disease, and then we can do deep brain stimulation. It is a surgical procedure, however, so we are very careful in making sure that only patients that can have the surgery. So we spend a long and very detailed time with our patient to make sure that they will be able to not only go through surgery safely, but also have the best possible results. And what are the patients that can have the best results? Of course, we need patients that have Parkinson's disease and not similar diseases. And this is something that usually a good specialist can define. We want patients that are relatively young, although I like to say I don't look at the ID of our patients, but especially patients that start losing their memory or having...
you would say in their 60s?
No, much later, much later. We start getting a little bit conservative when you are older than 75.
Okay.
And this is not a hard exclusion. It's not that if you're 75 and a weak, you're not going to consider the surgery, but definitely we pay much more attention. But up to age 75, if everything else is okay, it's pretty safe to have deep brain stimulation.
So you would agree that those patients with early Parkinson's that do not respond well to drug treatment have sort of a window of opportunity for this deep brain stimulation. Therefore, they shouldn't wait 20 years before choosing one of these procedures.
This is a great question, and there are two aspects to this question. One is the response to medication. So the response to medication is one of the most important criteria. If you do not respond to levodopa, you will not respond to deep brain stimulation. So you need to have a good response to levodopa, because the better you respond to levodopa, the better you will respond to deep brain stimulation. But then you might ask me, so why would you do surgery if you respond well to levodopa? Because we learned that after 5, 10, 15 years, the levodopa effectiveness tends to decline. And that's when deep brain stimulation can be most helpful. But you raise another interesting point, which is how much you want to wait. And in the past, people have probably waited too long to have the surgery for, how can I say, humanly very, very understandable fear of having brain surgery. But now there is very, very good science, very good trials that show that if you're a good candidate, if the medication are starting to give you problems, you can have surgery after maybe 7, 8 years from the beginning of the disease, and therefore never lose your quality of life and continue being well treated, first with medication and then with the stimulation. It's there is a very good study that was run in Europe. It's called the Early STIM study that showed that you don't need to wait 15 years to have deep brain stimulation.
Now that we're going to hopefully live longer, and people are living longer all the time, many more people will have these diseases. So the next question would be, what can we do to prevent Parkinson's or movement disorders when we get to that age?
Well, the short answer to that is exercise.
Okay.
But let me articulate it a little bit. So we know that the Parkinson's disease is a disease of aging. Aging is the only recognized risk factor that leads to Parkinson's disease. There are many other theories, many other speculation, toxin infections, but only aging is an accepted risk factor. So, of course, healthy aging will lead to less Parkinson's disease, but also less Alzheimer and other typical neurodegenerative disease of aging. We're now learning a lot about what happens before people develop Parkinson's sign. They develop other signs that we have neglected for many years, but they might be important. And there are three symptoms especially that we pay a lot of attention to, and they might hold the secret of Parkinson's disease. One is constipation, which many people unfortunately have. And I want to make sure that the message is properly delivered. Not everybody who has constipation will have Parkinson's disease. But we study constipation. I recently published an article on patients with Parkinson and constipation because we believe that we can learn about the brain, interestingly, studying the guts. The second interesting symptom is loss of smell. And loss of smell is something that people don't even go to the doctor for. They think maybe they have a cold or some other problems. But that is considered a precursor in early symptoms of either Parkinson's disease or sometimes Alzheimer's disease. And again, I'm not saying that everybody that lost their smell will have these terrible diseases, but this is something that people should pay more attention to because we may learn a lot from that. And the third symptom that we pay a lot of attention to is I like to call it almost like a funny symptom because it's what we call acting out your dreams. When we sleep and we dream, we usually are completely still and paralyzed, but some people move and act and talk, and sometimes they punch their spouse or they fall down the bed. And that has been recognized in some cases as a early symptom of Parkinson's disease, and we're paying a lot of attention to that. Why do we spend all this time on these symptoms outside of the brain? Because we believe that paying attention to what happens outside of the brain will ultimately save the brain from bad aging. But the only thing that we know today, and I want to conclude with that, is that exercising improves dramatically your aging. And so if you're not exercising, go out there and start exercising.
Very good recommendation. So do you feel that as we grow older, the population life expectancy is growing, you're going to see, besides Parkinson and Alzheimer's, any other neurological diseases that we rarely see? Is there a new number of diseases that we're going to start seeing in the future?
Well, there are a number of problems. I mean, we pay a lot of attention to Parkinson and Alzheimer's because this is my specialty, but actually the most frequent neurological problem is stroke. And that is due, of course, to lack of oxygen to the brain. But many strokes are related to aging, and in particular to two conditions. One is high blood pressure, and one is diabetes. And these are preventable problems. Even it's difficult to prevent having high blood pressure. Sometimes it's in genes, sometimes it's in what you eat, and it's difficult to prevent these problems, but you can treat them. And you can be very, very strong at treating high blood pressure and diabetes, and that will save a lot of problems to the brain in terms of strokes. The other problems that come with aging, which we don't have a good handle, is unfortunately brain tumors. But those are, the relationship with aging is much less well defined, and unfortunately we don't have yet a clear understanding of what are the risk factors of having a tumor. But Parkinson, Alzheimer's, and strokes, if we could only take care of those three big diseases, definitely we would have a much healthier aging in our population.
Okay. We've heard that at Cedars-Sinai, Los Angeles, there's a large program using stem cells. And it's something that we do hear a lot lately, and it's on the news and people are talking about it. Are you working with stem cells in Parkinson's?
Absolutely. I have the privilege of working with Dr. Clive Svensson, the director of our Regenerative Medicine Institute, which in lay terms is the stem cell laboratory, because stem cells offer two wonderful promises. And I want to make sure that I'm heard. At this time there are promises. One is to recreate virtually every tissue or every cell in the human body and study it and study what may happen to them under certain stress, how they may respond to medication. Just imagine taking your cells, organ, and create your stem cells, and then let's say you have a problem with your skin, and I can create your skin cells and then apply penicillin or any medication and see whether you have an allergy. Your cells will start having problems, and I will know that I don't have to give you that medication. It's what we call personalized medicine. We can start testing certain medications, certain ideas on your cell, not on a mouse or on another animal or someone else, just your cells. So that is one of the greatest promises of stem cells. And we are studying with Parkinson's disease specifically a program in which we take the blood cells of patients with Parkinson and we recreate, with their permission, their own stem cells. So we have Parkinson's stem cells that we can study and we can maybe try to understand some of the secrets of the disease. And it's important to make sure that people understand that we don't need anymore to take fetal cells and embryonic cells, which of course create a lot of controversy. And I'm not going to go into the controversy because everyone has their own beliefs and I respect those. The good news is that we don't have to do that anymore. I can take your blood cells, my blood cells, and by reverse engineering, create new stem cells. We don't need to do anything anymore that can hurt people's beliefs and sensibility. This is an enormous progress that we can now obtain. The last thing that we can do with stem cells is to treat diseases. And that is what everybody wants to hear. And I have to be very honest, we are not ready today to treat Parkinson's disease with stem cells. Today, but tomorrow we definitely will try to do that. But as I said before, first we need to understand better what is Parkinson's disease and what we can do. It's not as simple as taking the stem cell, put it in the brain, and hoping they will take over what the dying cells were doing before. But there are many things that we can do. We can tell stem cells to produce nutritional factors for our brain and keep it stronger and more resistant to this degenerative disease. And this is definitely something that we're working on. There are a number of ideas that now are being applied to ALS, which is a different disease but has a similar degeneration of cells. And we hope to start with Parkinson's soon.
Well, Michele, you just talk about many things. You're talking about prevention, doing the right diagnosis, using medications readily available to everybody. Then you have the deep brain stimulation, which you're an expert, and I do understand that you're doing that at Cedars for the patients that are good candidates.
Yes.
And then we have the future. We have stem cells, nanotechnology.
Yes.
So it's a very interesting future for ourselves and the patients with these neurological diseases.
This is the most amazing and exciting time for me. I drive to work every morning with a lot of enthusiasm because things are happening every day, not just at Cedars-Sinai, where we pride ourselves on being leaders in the Parkinson's disease research and clinical care, but all over the world. All our colleagues are contributing to this progress, and we are trying to translate it for our patients.
When you pick up the patient, sort of more or less the simple surgery involved and the results?
So absolutely, deep brain stimulation is a fascinating process which has 3 stages. First, we need to decide what is a good candidate, and this is something that a good neurologist, a movement disorder specialist should always do. But the most fascinating time for the patient is going into the operating room because you may not believe that, but the brain surgery is performed with the patient awake. And maybe she's like, what do you mean? Are you going to go into my brain while I'm awake? And the answer is yes, because First of all, the brain does not feel any pain. And so as long as we put anesthesia in the skin before we put a small hole through the skull, the brain does not feel any pain. So we can go in and out carefully without causing any pain. And we need the patient awake because we need to make sure that when we implant the wire and we pass the electricity to the wire, we're not causing any problem. Because I remind you that if you put the wire in the right place, and that's why you need a very good surgeon, you can relieve the symptom of Parkinson. But if you put the wire in the wrong place, you can cause all sort of terrible symptoms, from pulling of your mouth or seeing double or feeling pain or tingling or numbness. So we need the patient awake, also because usually we treat shaking, tremors. So we want to see that tremor and we want to see it going away when we pass the electricity in the right place. So it is a quite amazing experience. Some patients, I have to say, like it more than others. Sometimes they're not very happy of being awake in the operating room. But we are there as a team, and we try to reassure them and to keep them comfortable. And then after everything is closed and the battery, the pacemaker is implanted, there is a third phase. So selection, surgery, and then there is the stimulation, because just implanting the wire does not do the job. You need to deliver the electricity. And that is a science in and of itself. You need to know what you're doing, because if you give too much or too little electricity, you will have either no effect or side effects. And we have developed a method, a paradigm. I've been teaching at the Academy of Neurology for many years how to deliver the electricity to just eliminate the tremor without causing any other effect. And so it is a process that may take sometimes a month or two before, from the selection to the surgery to the achievement of the best results. But most patients, I have to say that this deep brain stimulation give them back their life. And they're very happy to have decided to go through it, and we use some of them, we ask some of them to counsel other patients that might be good candidates, but they are scared to do brain surgery, in order to have them realize what kind of benefits they can receive. That said, I have to be honest, it is brain surgery, and you have to do it carefully, in good hands, with surgeons that have good experience, because the problems that can occur, accidents that can occur during surgery, are very small in good hands. So the more experienced the surgeon, the smaller is the chance that something unwanted or complication may arise. So a beautiful journey for our patients, which I have to say in the vast majority of cases, because the complication, the accident, the problem in the operating room are only 1 or 2%. So I usually like to tell my patients, would you play the lottery if I tell you that you're going to win 99 times of 100? They look at me and say, oh yes, I would definitely play the lottery. And that's the type of promise that we can make. It is not 100% risk-free, but in good hands. The problems are reduced to 1 to 2% of the cases. And it is it's a therapy that definitely has completely changed the way we treat our patients, and offer the promise of 10 more years at least of good quality of life. Exactly.
Thank you, Michele.